Hello and welcome to the program. This is Health and Wellbeing, and I am Lois Asambu. Drug addiction has become a major concern in Nigeria, with the prevalence of about 20 to 40% of drug abuse reported among students and youths, respectively. This has in turn become a catalyst for many major social problems, including drug driving, violence, stress, and child abuse. Today we will be discussing drug addiction and mental health and ways which people struggling with addictions can overcome it. Our guest today is Dr. John Umobai, who is the manager and medical lead of Primly Services Limited. Dr. John, you're welcome.
Thank you very much.
And it's nice having you on the program.
It's nice to be here.
We're going to go on a short break, and when we return, our discussion will commence. Do stay with us. Welcome back, and thank you for staying. Before we went on the break, I told you we will be discussing drug addiction and how it affects mental health, and also the way out for people that are struggling with drug addiction. I told you Dr. John Umobai is here to discuss this with us. Dr. John, you're welcome once again.
Thank you very much.
Well, straight up, I'd like us to start with, how do people get to the point where they start having addictions?
How do people get addicted?
How do people get addicted?
That's a difficult one, because there's no predetermined way people get addicted. I usually just say, don't start. If you don't start, you don't get to battle it. Right, so case scenario, a young man goes to a party unassuming, nothing, not expecting anything, just expecting to have fun. He's there, sits by the bar, has 2, 3, 4 of his friends with him, and then just thinking, oh, I'll just do a little drink, alcohol here and there, and then he sees some people doing some stuff. His friend joins in, everybody's trying out new things. He feels like, I'm the only one not doing this. Why should I not? His friend passes to him, and he's contemplating, do I not? And everybody nudges him, why not? Go ahead. And then, okay, I'll give it a shot. And then he takes one joint of whatever it is. He feels a rush in his head, extremely euphoric, excited. The sound of the music appeals more. His heartbeat is in sync with the theme and the beats of whatever is going on there. And this lasts for a few minutes. And after that, he feels some rush. And then he feels like, what just happened? And then he begins to feel like, I'm no more in sync with the music. I'm no more in sync with the party. The party is becoming dull. And then he sits down reflecting. And then his friend comes to him again and says, what's wrong? No, nothing is wrong. Are you sure? He says, no, I just feel somehow. Try it again. You feel better. And then he goes a second time. And then it starts. You just never know. Right? They're not planned circumstances. They're not planned situations a lot of times. Yes, some people actually may be going through certain conditions. Maybe, let's imagine she's depressed. Another case scenario, she's depressed, low moods, feeling down, crying, being like that for days, not helping, her friends come around. Oh, you know what? There's something that can make you feel better. Why not try this? And boom, she tries it. Or another guy, he's finding it difficult to sleep. He's been having sleep issues for some time, and it's just all over the place. He has tried, he gets probably 3-4 hours sleep at night, wakes up every morning feeling inadequate, feeling like, I haven't had enough. And that puts his entire day in undue stress. And then he speaks to a friend who comes and says, there's something, if I give it to you, would make you sleep better. Are you sure? But I've tried taking this, I've tried that, I've been to the hospital, nothing seems to work. Just try this. And he takes it. First time, second time.
But these things don't happen in an instant, yeah? Like, how long does it take for someone to get to the point where it's like, okay, I'm hooked on this?
There's no specific time. You can't put a time to it. And let's not forget that people are different. Same way you would react to something is different from the way I would react to it. We all have different justifications for use. We all have different reasons why we use. People don't even know when they are addicted.
Oh.
A lot of times. You don't find anybody coming to, oh, I'm addicted. When somebody's telling you, oh, I'm addicted, you probably want to check that all over again. They usually won't tell. They probably won't know. It just becomes part of them. So there's no taking time to it. Some people a few weeks, some people a few days, and they're hooked on it. Some people at the first try, they love it, boom, and they just don't want to stop. They just go. But then that doesn't mean that they're already mentally addicted to it, right? Because addiction comes with some other changes that happen mentally with the brain. And so there's really no time to it. The only advice there is just don't start.
And you said something about mental addiction. I'd like you to explain more on that.
Okay, so I think I'll probably start with defining what addiction is, right? Addiction is a chronic relapsing brain disorder, some texts will say brain disease, characterized by compulsion to use that substance, right? Building of tolerance, trying to stop once or a few times and not being able to, and still having to use despite knowing the consequences, usually the negative consequences that such a substance or a habit is doing to you. Now that's addiction. What does that mean? It means that there are actually brain changes that occur with the individual, right? So it's highly implicated with all most psychoactive substances have a great relationship with dopamine. They increase dopamine levels in the brain. Right? Dopamine is that substance when released. If I give you 100 million naira now, oh yeah, that's the
This
feeling.
kind of makes
That's the feeling. Now dopamine has just been released in your brain. The good feeling. You see how you're reacting? Yes, just the thought of it. Right, dopamine is released and you feel good. Your pleasure centers, your reward centers in the brain are triggered, are excited. But then you have just enough for a certain duration. You're back to earth now. Welcome back. That's the feeling. But however, when you take a psychoactive substance, the release of dopamine is shot up beyond reasonable amounts. So imagine what you felt now in multiples of thousands.
Oh.
You probably can't imagine it, right? Yes. And that's what happens. And there are receptors in the brain that are responsible for mopping this up. So what now happens is over time, I'm trying not to
be very medical about it.
because I guess our audience, everyone is medically inclined. After some time, if the amount in the brain that you used to was 5 ounces, and then these substances is releasing 95, after some time, you have receptors mopping up, building up to be able to accommodate that 95. And then when it all fills up, you now feel like that 95, that amount you used to take to give you that feeling is no longer enough because it's been mopped up. Then you now want to increase. So I used to do 1 bottle of beer and it makes me feel good. After some time, that 1 bottle does not make me feel that way. I have to increase to 3. Tolerance has been built. So you see the changes that are occurring, and this takes some time. Tolerance has been built, and then he moves to 3, and then the same process happens again, moves to 5, same process. Same thing would happen with probably a joint of marijuana. They start with 1 joint or just a few puffs, and then after some time they're not getting that feeling. They have to increase to 2 joints, 3 joints, 4 joints. Before you know it, they're probably smoking around the clock, the whole day. So it's, and with this, comes behavioral changes, lifestyle changes, because these substances affect who we are, our moods, our behavior, our thinking process, several other things beyond just the physical health effects that it has.
Well, now, I'd like us to talk more on the mental health. Now, you've explained what dopamine is and all of that, but how does now addictions affect people's mental health and like mental stability?
Okay, like I mentioned, there are psychoactive substances, right? In that state, there are certain things that are, certain faculties are affected, cognition. Okay, let me not go too technical. I think I'll just come down to the effects. So people experience extreme euphoria depending on the kind of substance, right? But generally extreme euphoria. Some people get paranoid and overtly suspicious. These are effects you will get. Mood changes. So with the high, with the extreme high, there's a rebound low that comes after. So they get moody, they start keeping to self-isolating, being locked up in the room, sometimes just so they can actually even use. But these are mental health effects to it. Some people, psychosis, right? Some would use the term out-of-body effect. So they begin to hear voices, they begin to see things that are not there. Voices can come in form of commentaries, so they hear multiple voices or single voices just talking about them, and they can hear it as loud as we are communicating, but those people are not there. Or even giving them instructions, or telling them derogatory things or horrible things about themselves, whatever it may be, but they're hearing voices, or they're seeing things. Poor sleep as well can affect down to appetite, increased appetite or decreased appetite, mood changes, right? The thinking process is also affected, so judgment becomes poor, right? And then lack of inhibition. So things naturally you would caution yourself to do, you would freely just do it without any inhibition. So risky driving, risky behavior, unprotected sex, a whole lot of things. That's why, I don't know, if you really come across people under the influence of substance, you would, with close observation, you would notice these things, no matter how hard they try to hide it or keep it there or conceal, because nobody really wants to
say that they are addicted,
or in quote, get caught that I'm using a substance.
Well, now saying this, I'd like us to talk about being able to help people that are struggling with addictions. Like you said earlier, they may not necessarily come out to say I'm addicted and like, okay, doctor, I need help, I need help, I'm addicted, I'm hooked on this. Well, I think we need to go on a break, and when we come back, then we'll discuss about how people that are addicted can overcome it, because honestly, I believe there's nothing that cannot be overcome, medically or spiritually or whatever way. But when we come back from this short break, we will discuss on this. Do stay with us.
Today was a demonstration of leadership and faith in the safety and efficacy of the vaccines. I have received my first jab, and I wish to commend it to all eligible Nigerians to do same, so that we can be protected from the virus. I urge all state governments, traditional and religious leaders to take the lead in the mobilization effort within their environment and spheres of influence. The vaccine offers hope for a safe country free of coronavirus. I similarly urge all eligible Nigerians to present themselves and be vaccinated in accordance with the order of priority already mapped out at the various authorized designated centers only.
Welcome back, and thank you for staying with us. Before we went on the break, Dr. John and I have been discussing drug addictions, And before we went on the break, I said we're going to talk about how people struggling with drug addictions can overcome their struggles. Now, Dr. John, how can people overcome drug addictions?
Thankfully, there's help. Thankfully, there's treatment, or what we call management. Before we get to that, I'll touch a little bit of the effects, because it's important we know that since the management is holistic, some effects are social effects, apart from the behavioral and mental effects. So family is being affected, resources are being spent. Imagine an individual having to pawn things in the house, sell things in the house, probably steal things in the house, poor academic performance, not being able to cope at work, not being able to maintain a relationship with your spouse or even other family members. It's affecting every member of the family. So not just the individual. And I would also like to debunk a certain assertion most people have, that until the individual has gone down to ground zero, you don't say the individual is addicted. So more like he's walking on the street and then he's become a nothing good. No, that's not what addiction is. The individual may be able to function in certain areas of their life, may be able to go to work, function at work, but however, just that one aspect that the individual cannot. Imagine a married man who cannot stop and is affecting his marital life, yet he can't stop. Awesome at work, call him a workaholic if you like, right? He's doing well financially, but that aspect of his life is being affected, yet he can't stop, even though he's trying to. He's addicted. Or a young man or a young girl who just can't cope with school, has dropped out in 1, 2, 3, even once, or academic performance is poor due to substance. All other aspects of life remains intact, remains amazing. Some people are academically awesome, but other areas in their lives have been affected. Then you say the individual is addicted. Now, why did I have to point this out? Because when it comes to management, it's holistic, right? We need to factor in every aspect of the individual's life. And professionally, there's professional help, right? And that's where mental health physicians come in. There are drug rehab centers that people can access, right? I, for one, I'm a mental health practitioner and an addiction practitioner as well. So I can tell you a whole lot about it. That's something we could go to town on, or maybe in another segment or at another time we could discuss that extensively. But there are drug rehab centers and would involve different forms of therapies, medications where indicated, especially when there are physical effects of withdrawals, right? Detoxification processes, and a whole lot. Family therapies, because like I mentioned, family is affected, reintegration back into society. It's a long process. So it's not just like
headache, you take
exactly, you have malaria, have a lumefantrine, 3 days dose, and then you're done. No, we're talking about months, years, and even beyond that, it's a lifelong battle. And the individual needs every support, both from professionals and family, which is why I mentioned family. And in cases where there are underlying mental health conditions or other conditions predisposing the individual to use in the first place, those have to be dealt with. Imagine someone who went into substance to battle or cope with depression or anxiety. If you don't treat the underlying condition, then you'll probably just be going around in circles. So all of that is factored in. And then if there are other health effects, maybe the individual has developed hypertension because of the substance use or other non-mental health related conditions, those also would have to be treated. So it's a very holistic approach.
Now, as a practicing therapist and psychologist, I'd like you to share with us your experiences, like on probably one specific aspect where you were able to help someone. So what were the steps that you took for this particular person to the point where the person was able to overcome this addiction?
Okay, let's paint a scenario. Is that what you mean?
Sure, yes.
All right. So let's imagine a young lady, because males and females are equally affected, or a young guy. Individual is assessed. We know what the individual is addicted to, and then we know if the person is actually addicted or dependent or just a user, at least to what extent. After the assessment,
So we have addiction, someone that is dependent, and is also, are those like three different categories of how you would categorize someone is hooked on substance?
Yes, different degrees of substance use, right? But be that as it may, help is required, and that will determine what kind of help. And then the type of substance also determines. So for instance, the clearance time for the different substances in the body vary depending on the kind of substance. Some will take days, some will take months, some will take weeks, and that will determine how long you would detox such an individual. So what's most recommended is an inpatient rehabilitation process initially, and then transition to outpatient. So you start with because you want to be able to control the individual's access to substance. At least that period where you have serious withdrawals and extreme cravings. If the individual is not well protected or shielded from those substances, you are sure that the individual will go back to use, because remember, they cannot help themselves. It's a compulsion to use. They have no control over it. So you find a lot of people say, oh, it's a behavioral thing. No, it's not a behavioral thing. If you remember, I explained, at least threw some light about what really happens in the brain. So it's not just a behavioral thing. It's gone beyond that. There's a behavioral component, but there's also a psychological component to it, right? And there's a medical component to it as well. So it's important that the person goes through detox, after detox, of different forms of therapies, ranging from individual psychotherapy sessions. There are several types of psychotherapy sessions. I won't go into all of that at the moment. So different forms of therapy, right? And at the same time, treatment for withdrawals or whatever it is as the case may be. And it's an ongoing process, because there's still relapses can happen. Slips can happen, and then relapses can happen, and then it feels like everything just went down the drain. No, it did not. If the individual was here, you've gotten to this point, and a slip happens, the individual is not crashing down to the floor. It's just a few steps down, and then you can pick up again and continue. And substances are everywhere. The influences are everywhere. Right, the triggers are both intrinsic and external to the individual. And these are battles that would be faced over and over again. But what treatment does is treatment helps the individual stay away from substance, helps the individual stay sober.
But I came across one form of therapy last week, and it was through an art therapist session that he organized, yes, in commemoration of the World Drug Day. And that's art therapy. I'd like you to tell us more about that.
Did you enjoy it?
I did, even though I didn't get to paint, but I enjoyed it.
Yeah. Art therapy is one of the forms of therapies used in or employed in treatment of addiction. Not just addiction, a lot of mental health conditions. It's interesting how people can express themselves through art. Right, so what you can't say, what's difficult to express in words, because you may feel criticized, or you feel they won't understand, or you feel, what would they say? Well, being able to put it down on canvas, or in painting, or in whatever art form it is. Some people even sculpt, and they're able to express themselves. It goes a long way in therapy. As a therapy, right? Now, being able to distract themselves, even just for one, I'm craving, and then I'm able to focus on an art. and then I go into painting. And then after some time, I just realize, okay, I'm no more craving. My mind isn't there anymore. That itself is therapy. And that has helped a lot of people. From the clinician's perspective as well, like I mentioned, being able to express themselves, the art therapist will be able to interpret what has been painted or drawn or expressed in that form and be able to tell what underlying conditions the individual may be going through or has been going through, or what psychological stressors are ongoing with that individual. And it's very, very interesting. I know you saw quite some.
Yes, I
quite a
saw
lot, and
quite some
people
amazing
expressed themselves,
paintings.
yes.
Yes.
And when they did explain, it was amazing what was going on with them, right? And that's really how it works. Beyond that. So imagine someone who is depressed. There's a way it's going to be interpreted. There's a way the person would express it. Someone who is anxious. Someone with different kinds of mood disorders, even low self-esteem, right? Someone with grandiosities would express themselves differently on canvas. So it's, and that helps a lot. So imagine I, as a doctor, work with an art therapist, and then the therapy is being done, and he comes and tells me, oh, this individual is going through depression at the moment. This and this and this is what we have been able to deduce. These are interpretation from our therapy. And then I know what to treat as an underlying ailment that probably would have been a trigger for this individual substance use in the first place, that the person may not have been able to express verbally.
With words. Well, thank you very much, Dr. John, for taking our time to be here with us on health and well-being. And I know that there's still a lot for us to discuss, so we'll still make out time another time to invite you. We hope that when we call on you, you would still take out time to be here with us.
Definitely.
Thank you very much. But before we leave, I'd like you to just give a word of advice to people struggling with addiction out there.
Okay, first advice to those who are not, don't try it. Don't even make an attempt. Don't do drugs. Don't be tempted. Just stay away. For those struggling with addiction, there is help, and there's just one advice: seek help. We're all around. We're just a phone call away. You can reach me anytime as well, right? Good thing is at least you have my contact. I know by virtue of this program, some people will reach out to you and all of that. That's fine. But there's help. And that's the most important thing. Sometimes people just feel that they're lost in that world and no one can help them. That's not true. There's actually help. You have failed a number of times does not mean that you would keep on failing. There's actually light at the end of the tunnel, and everyone is available, including professionals, to help drag you out of that pit.
Well, thank you very much, Dr. John. And just to round it up, Dr. John is the medical lead of Primly Services Limited. So if you're in need of help, you can reach out to him over there. Well, that's the size of our package today on health and well-being. Do remember, if you have not started, do not start. Do not try it. And if you're hooked on something, there is help for you, and please reach out for help. Do keep it to date with us. Same time next time. I am Lois Apasambo. Do stay safe and do not do drugs.